The HIV/AIDS prevalence rate in Rwanda has remained at 3% for some time now, and those who have been living with the virus for decades are grateful to be getting the antiretroviral drugs that keep them alive. I found out I was positive in 1999 and was soon paralyzed, becoming bedridden. In 2003, I started taking the antiretroviral drugs and began to improve gradually. When I started taking the drugs, my white blood cell count was at 260 and now it is at 800. I can carry heavy loads. Basically, anything anyone else can do, so can I. I have had AIDS for the past 25 years. I had lesions in my head with water coming out. My entire body was full of blisters. As soon as I started taking the drugs, all that went away. I can now sell things and feed my children, raising them. Claude and Maria also told us that they are no longer discriminated against as it used to be. Certainly things have changed for the better, because when I was very ill, no one in my family dared to approach me. They would give me food by pushing the plate with a stick towards my bed. Now they are no longer afraid of me. We socialize with no problems. People were afraid to even share meals with us, referring to us by our HIV status instead of our names. They would say that we are pretty much dead. Now, however, because we look just as healthy as them, they no longer look down on us. We are no longer discriminated against and do not face any problems. The HIV Rwanda includes sensitization campaigns telling people how they can protect themselves from infection, while helping those already infected remain alive through the use of antiretroviral drugs. Close to 200,000 people in Rwanda are HIV positive, and more than 90% are on antiretroviral drugs, which has helped to significantly reduce the number of people who die from the virus. The drugs helped to reduce the death figures very significantly. When there were none in the country, all people infected could very well die easily. When we started providing the drugs, and there was a limited supply here in Rwanda and around the world, only the very sick got them first. A person without full-blown AIDS got none, and again, many people died. However, since 2016, anyone who tests positive to the virus can begin taking antiretroviral drugs on that very day if they want to. And that is good, because doing so early means the person remains relatively healthy and does not spread the virus to others. The head of the Rwanda Network of People Living with HIV, that was founded in 2003 and now has more than 130,000 members, says the government's efforts to fight the virus have given them a new lease of life. I found out I was HIV positive in 1998, and finding out you were positive then was a death sentence with no vaccine or medicine. I had developed a severe cough, and when I went to hospital, I was tested for tuberculosis and HIV, and they found that I had both. I wanted to walk right into traffic and kill myself. Many people died at that time because they did not have access to drugs. Hearing of so many people passing away, even neighbors close by, I thought I was next, but look at how long I have remained alive, just because the government provided those antiretroviral drugs. In particular, the efforts of Her Excellency Jeannette Kagame, resulting in the PMTCT program that helps HIV-positive mothers give birth to babies who do not have the virus, really helped us, because before, many women infected their children with the virus at birth. On the 18th of June back in 1980, the first HIV-positive person was identified in the world. That was in the US. Since then, it has spread to more than 70 million people, killing more than 35 million of them. The first case in Rwanda was identified in 1983. In 1988, the UN designated December the 1st as World AIDS Day. Thanks to efforts to fight the virus in Rwanda, mother-to-child infections during birth have reduced from 10 to less than 2%. Nevertheless, in the last year, HIV/AIDS killed 2,841 people in this country, infecting another 5,265. 30 million free condoms were also distributed to fight its spread, and 300,000 men were circumcised a practice that has been found to reduce the risk of infection by up to 60% during intercourse.